Welcome to Let's Just Do This, the podcast TV show live on location from the Toronto Congress Centre. I'm Todd Miller along with Margaret Wallis-Duffy.
What a pleasure to be here in a ballroom full of amazing naturopathic doctors at the Ontario Association of Naturopathic Medicine Convention. You know, it absolutely fires me up, Todd, to be able to bring guests to our table to talk about integrative health and how we can make a difference. Today is really unique because we're also really bringing in another equation to the conversation with naturopaths. And perhaps for some, it would be an unlikely combination, having a pharmacist with us. So it's with great pleasure this afternoon that I get to introduce a friend and colleague and someone who I've had the opportunity in the community of doing work with for many years. Nishant Parikh is a compounding pharmacist from Kensington Compounding Pharmacy. An amazing, a new dad, by the way, a young child who's absolutely beautiful, but he is here to actually let us know how much he believes in the work of integrative health. I can't thank you enough for coming and joining us.
Thank you, Margaret. This is my first podcast, so please excuse me, my nervousness might just come over me. But definitely, integrative healthcare is the way we should look at the health system should go, because I feel a lot of patients are losing out the opportunities to have exposure to different healthcare professionals. Because me as a pharmacist see patients every day and have no clue where to refer them when I need to. Having an integrative healthcare would be just an ideal setup where we can look at these things much more differently.
Absolutely. And Dr. Hilary Webster, who's been a guest on the show many times and a very passionate naturopath who I have the pleasure of working with day in and day out. Dr. Webster, why is it important to you as a naturopath to be linking arms with a compounding pharmacist from the perspective of a naturopathic doctor?
Thanks, Margaret, for having me on again. I love working with compounding pharmacists because they're another addition to the team. It takes a community to get someone well sometimes, especially in complex cases where you really need to think outside the box. If somebody's been to all sorts of doctors and other therapists, and then they're coming to you because you are their last hope, you really need to do service to them. And so sometimes you need to be doing some custom formulations for them. And I love going to my favorite team of compounding pharmacists. I've befriended some of them, and they've been incredibly helpful and instrumental in bringing results to patients. So, for example, I'll share with you a story where we were working with a patient who was having some issues with some genitourinary trouble, some pelvic health issues, and we compounded for her a curcumin-based topical. And the problem with curcumin, powerful anti-inflammatory though it is that it stains everything, as we know. So we were actually working with the compounding pharmacist to find white curcumin, which is a little bit tough. And we're working to just try to find the best solutions for our patients and in order for their best interests, in order to best serve them.
You know, I love that story and the fact that you're constantly seeking out connection to improve the health and well-being of patients. You know, one of the things that I love about this discussion is that, once again, it's empowering patients to have choices and to not feel like it's an us versus them approach, but rather bringing people together and working collectively as a team. Nishant, can you explain for those that are listening, and many here in the ballroom certainly know what a compounding pharmacist is, but for those that might be listening at home, can you explain to us what is a compounding pharmacist and how does it differ from just a regular pharmacist?
So a pharmacist is the person who has all the knowledge about the drug, right? So that's a hat of a pharmacist that I'll be wearing when I'm working. But compounding pharmacist just gives me an extra opportunity and wear another hat. I'm not losing my pharmacist hat. I'm doing both the jobs at the same time. And I have to think out of the box, as Dr. Hilary says. I have to figure out something out of the box when regular conventional drugs are not available. And it's not just as simple as mixing things in mortar and pestle. There's more chemistry involved. There's more stability factors involved. So those all knowledge comes along with being a compounding pharmacist.
I think that's a really wonderful point that Nishant brought up. As a naturopathic doctor, I don't want to do math. And so I find it's really, really helpful when I can go to a compounding pharmacist and say, hey, so I've been seeing some research that says that, green tea is a wonderful topical for acne or some other solutions for skin issues. What concentrations do we need? And they can pull up that information for me. They can pull up those studies, and together we can collaborate to find that custom prescription and really tailor it to the patient's needs.
Yeah.
I love that. And working together is so, not only so powerful, but so empowering. What I love about what we're experiencing here right now is that we learn from one another. And all of us bring a different skill set to the table. And when a pharmacist can be helping out a naturopath, but then the naturopath, and would you agree with this, Nishant, you're here to also learn from naturopathic doctors.
So a lot of things like doctors bringing it up now, like green tea, right? I didn't know anything about green tea. When she brings it up, I go and research, and I also find out that green tea is also used for scarring, and it's an amazing anti-scar cream. I can make a topical of it, and I'm learning from the doctor, naturopath, everyone. Like, it's a learning tool for us as well, like integrative healthcare.
Now, Todd, I know you're dying to ask a question. I can just see that look on your face. I know that look.
We sort of talked about what the difference between a compounding pharmacist and a normal pharmacist is, but what I'm hearing though is that it's not one solution for all. It's many solutions depending upon the symptoms that are being presented and the options that you're returning back to that person. Is that true?
Isn't that the beauty of naturopathic medicine? We treat the individual as the individual, and we're trying to look under the hood to see where all of the issues are. And so once we get those answers, whatever testing mechanisms we're going to use, then we can craft that personalized solution for them. So I would go to the compounding pharmacist when I see that there's a particular hormone deficiency, for example, and I say, well, I think we need, say, 20 milligrams of progesterone, and it might be a great idea to do it transdermally. And if I can't, and if maybe transdermally isn't even the best solution for them, and that compounding pharmacist may be able to connect me to a doctor who can prescribe oral progesterone, which we know is better for sleep. Like, we're really trying to create the best plan for someone for who they are and where they're at, because meeting them where they are is crucial.
Oh, I love that. And individualized medicine is so critical. And as we spoke about earlier in my discussion about communication and communicating with physicians or anyone else in healthcare, we need to find that common ground, but we also need to be open and willing to listen to what other solutions there are. Nishant, just before we end up this part of the segment, your pharmacies are often attached to medical centers that have physicians. Has it been your experience that you're seeing more and more physicians that are at least connected with you and what you're doing, that are open to integrative health?
I've seen a lot of doctors are now being very open-minded on the option of going to a naturopath or any natural way of treating a lot of conditions, right? Because I've been treating a patient with thyroid issues and been giving the same dose over a period of adjusting the doses. But as Dr. Hillary says, like, we need fine-tuning. We need an adjustment of the doses. That's not possible in a normal, regularly, commercially available medications. So that's where the compounding comes into play. If somebody's getting 30 milligrams, 37.5 milligrams of synthetic hormone, we can, it's micrograms, sorry. So we can give a desiccated thyroid hormone capsules, which can be compounded of 32 milligrams or 31. We can fine tune to whatever the best approach is required for the patient. And at the same time, we need a doctor who can also help us monitor the labs. So doctors are open-minded. I see doctors now not looking as a competition to this profession. They are looking at it as a team. And I see a lot of doctors want to work within the group.
Well, and I know we all know there's still a lot of work to do, and there are many, yes, that are resistant. But what I do love about what we're doing here and educating is to empower people that they do have options, and then to also show physicians that we're willing to work together. So we're going to take a short break here, and we're going to come back, and we've got more discussions with Nishant and Dr. Hillary Webster here on Let's Just Do This.
Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallis-Duffy. We're live on location from the Toronto Congress Centre, the Ontario Association of Naturopathic Doctors Convention 2018.
It has been so much fun thus far, and we started a discussion with Nishant Parikh, a compounding pharmacist from Kensington Compounding Pharmacy, and Dr. Hilary Webster, naturopathic doctor. You know, it is so important when working together that we have a patient-centered approach. And so what I'd love to really talk about right now, and perhaps Hilary, you can start off, when we're looking at you sitting next to a pharmacist, as a naturopath, what are your hopes in terms of patient care and using integrative health and linking arms with professionals like Nishant, as well as other doctors, from a patient perspective?
Wow, now if you want to freeze me in my tracks, ask me what my hopes and dreams are. Oh my gosh. In a perfect world, I was actually just speaking to a doctor, a family doctor, a couple weeks ago, and we were on the same page, and she said already that she had a few patients in mind where she's just kind of shrugging her shoulders. She doesn't really know what to do for them. And that's where I assured her, this is where we can collaborate. This is where I fill in the gaps. This is where I help your patients be as healthy as they can be where they are. This is also where I ask a compounding pharmacist if we say their T4 prescription isn't working particularly well for their thyroid. I know we've talked about thyroid quite a bit. Say their T4 prescription isn't working very well. Maybe desiccated thyroid is the place to go next for them to get them the results that they want. But what if the dose isn't being titrated properly? What if we need to, maybe their body has responded in a way that's unexpected. Maybe we need to troubleshoot. So there have been times, plenty of times, where I've gone back to a compounding pharmacist and said, well, they responded in a way we didn't expect. What do you think? And we have a dialogue and we have a discussion, and that's really the beautiful part of what I do, which makes it truly integrative.
Fantastic. Now, Nishant, as a pharmacist, you're often the front line of defense. So they've just left their doctor's office and perhaps they're in front of you. Can you speak to the accessibility aspect of having you as a compounding pharmacist and your role that you can play in helping to connect them with others like the professionals sitting in this room?
So, being a healthcare professional in a pharmacy, right? So, you can walk in the pharmacy anytime and see a pharmacist. There's no appointments needed. So that makes us the most accessible healthcare professionals. Having said that, we'll get so many patients throughout the day who would have issues which are getting not addressed after even trying the conventional medications. So that's where the opportunity comes, where I can see a need of an extra tool that a patient may be having an opportunity to get exposure to, and that's where the naturopaths come in play. That's one area where I see, and I look at it as a problem-solving person in a way such that I don't have answers to all the questions they ask, but definitely, as you said in your speech earlier, I will get back to you. So definitely I can look up a lot of options and get back to the patient and at least have a solution to the problem, not having them left in completely dilemma of what needs to be done.
Right. Hilary, I can see you're dying to say something.
I just wanted to add one more thing. I think the beauty of what we do in this collaborative effort would be to refer back to each other. I have had, in the past week, 2 patient appointments where I've been chatting to people about the pharmaceutical prescriptions that they are on, because I do a fair amount of education of my patients about their drugs, but they asked me some questions to which I did not know the answer. Things about the more subtle individual reactions to certain medications. And I said, you know what? You should go back to your pharmacist and talk to them about that. And both of those patients said, you know what, that's an excellent idea, thank you. And sometimes we feel like we want to know all the answers, but realistically, it's not my scope of practice. Yes, I can teach you, I am trained in pharmacology to this extent, but these are the people you want to talk to. Seek the experts who know the knowledge.
You bring up a valid point, and that is we really need to be advocates for our own health care more so than we're doing already.
Yes.
And I think there's a perception that people think, oh, if I question my pharmacist, am I judging them? Am I making some sort of judgment about their knowledge and what they prescribed?
So, good point. If you go to see, I've seen the last 12 years of the pharmacy world, not too old, but what the pharmacies were before, they would have a high platform. They'll have glasses. They are shielded. So basically, a patient does not have an access. But nowadays, the pharmacy where I work, we have a frontage like a bank teller. Like we want to see them completely what we are doing. So we are showing that we are very accessible. We
Yes.
are there for you. And that's where the culture, the paradigm is changing. There are patients who are coming in asking questions. They might be having, just giving an example, as Dr. Hillary said, coming with muscle aches and pain. But there are important questions a pharmacist can ask, like what medications are you taking? Like statins, chronic side effect of statin can lead to muscle aches and pains, and then there are certain medications or vitamins or supplements that can be given to take care of those side effects.
Or you can send them for a massage too,
Yeah, for sure.
because we're better together. Yes.
So that's a simple example where a pharmacist being more accessible and having an integrative approach, have access to refer to different professionals would make a perfect picture.
Fantastic. Well, we've got a lot of hopes and dreams, and today we were only able to discuss just a few. But what I loved the most about this is that we're bringing healthcare professionals together to be better together, to put the patient at the center, and to help empower them through education and choices so that they and their families can live well. Dr. Webster and Nishant, I want to thank both of you for coming up here, and of course on a stage at a time where you've never done a podcast before in front of a couple of hundred people. I want to thank you. Can we give them a round of applause for coming up here and doing that? And more importantly, I want to thank the Ontario Association of Naturopathic Doctors and all of you naturopaths that are out there in our communities making a difference day to day in the health and well-being. If you're listening to this podcast and want more information about naturopathic medicine, we will certainly in the show notes drive you to some resources. If you have questions, reach out to us and ask. We are here to answer them. That's what Let's Just Do This is about. We want to hear what questions you have so we can bring change makers to the tables to have soulful discussions that will truly change the legacy of healthcare in this country. Well, Mr. Todd Miller, we better move the stage off the stage here. We got another panel going, and to all of you that are here for the convention, have a fantastic convention. Learn all that you can, and until next time, be well.